Do not attempt to remove anything that goes in your ears. Watch this video first, and at the end I'm going to show you why this little thing that you're looking at right now on your screen, this is a button battery. These are found in watches, they are found in very little devices, but when this little thing goes in the ear of your child, trust me, you create a lot of problems. This is an absolute emergency. And when we talk about a foreign body, we mean literally anything that's not supposed to be in your ears. And this commonly happens with children because naturally they are very inquisitive. They just like to touch things, they like to explore. So you'll find literally they are putting things in their nose, their mouth, and even their ears. However, this can also happen to adults. We all know that ladies, especially you who do your hair and whatnot, you're sleeping on a bed that has a lot of beads, and then you find something has gone inside your ear. What then are you supposed to do? So like I always say, firstly, let's understand the anatomy. Let's understand the ear first of all, so that we know the dangers of just not poking things anyhow when something goes there. So firstly, your ear is, as you are seeing right now, it has three parts basically. You have the external part, most of the parts you can actually see. That's the one that you call your ears. But then there's a middle part, which we call the middle ear, and then there's the inner ear. In the middle ear, there's a very important layer, sort of like a membrane that we call the tympanic membrane. Very, very important part of the ear. So now this one allows when, like, let's say you're hearing something and then it vibrates. It vibrates and then sends signals through the little bones there, and your brain interprets them as sound. So in short, without this one, your hearing becomes impaired. And also, it protects the structures that are found inside. Now, the reason I'm telling you about this part of the ear is that it's very important when it comes to injuries of your ear when something actually goes inside. All right, so now for us to understand what you need to do, we have to think about where this foreign body has actually gotten stuck. So let's say, for instance, you get maybe a bead, whether a baby or an adult. If you put the bead in your ear right now, it won't go all the way inside because, like I told you, the tympanic membrane is protecting you. So it will get stuck very close to the tympanic membrane or somewhere close to the surface. If this happens, easy peasy, if it's something that's not damaging, you can literally tilt your head as you are seeing right now in this photo, attempt to shake your head, and maybe you might actually get it out. And the second situation is, let's say something goes in your ear and this is something very sharp. This one, trust me, you need to go to the hospital as quickly as you can, because what you're dealing with now is that tympanic membrane can be cut, it can be perforated. Now when this happens, you get to see certain signs. First of all, your hearing may be impaired, and then secondly, you develop a very, very bad pain. Thirdly, you can have discharge. Now this discharge can either be blood, it can either be pus, or it can be a very clear fluid that is coming from your brain. Now these are danger signs. The moment that you see these things, you need to rush to the hospital as if your life depends on it, because it actually does. All right, we got that. Now these are the things that you need to avoid. Number one, water. Water isn't something that you should be using to flush in your ears just for literally anything. For things like food particles, for things like these late vegetables, or maybe let's say cotton, something that when you put water, it starts to bulge up a little bit. You'll make it more difficult to get it out. For something like a bead, if you're someone who knows what you're doing, you can actually get it out. In the hospital setup, we can actually do an ear syringing, as you are seeing in this photo right now. So we just push in water to try and hit the tympanic membrane, and that pressure when coming outside the ear flushes out the rest. This is what we usually do when we're actually removing wax. But if you are not specialized with such things, I trust you come to the hospital and it's handled there. The second thing is oil. It's not everything that requires oil. When something goes in your ear, you put oil, you think as if you're lubricating it. No. Unless maybe it's like, let's say, an insect, especially an alive one. The oil is going to suffocate it inside, and then maybe you can tilt your head again so that you attempt to remove it. Otherwise, if it's not an insect, honestly, I don't know any other situation that you have to use oil. Now remember, I told you about this small battery that I talked about. And basically, if you have to get away with something in this conversation, it is this very one, to protect these little kids. These button batteries, when the kid puts them inside the ears, have a very bad effect. They can literally eat away your parts of the ear and the skin that is found inside. So this is what a battery does. When you put it inside, it's sort of like your body conducts electricity. So you create like a complete circuit of some sort. Now when this electricity is passing, you'll be releasing certain electrolytes or certain ions, if you may. So now the important one is going to be this OH. It's a negative sign. So now the more negative that is there, it's going to increase, and then this thing that we call the pH is going to become alkaline. So it goes alkaline. The way you know acid, now on the other end is the alkaline. Alkaline is way more dangerous because it chews literally your skin, it chews through tissue and whatnot. Now remember, this is a child who you may not even know something has gone in, and then maybe this child just starts crying excessively. And this is why we say any child who's just crying from nowhere, you have to check their nose, you have to check their mouth, you have to check their ears. This is how problematic kids can be. So you might never know, but just check the ears. So when you notice that a button like this one, a battery button, goes in the ear of your child, please rush to the hospital. Rush to the hospital, because the life of that child depends on it. A lot of complications can occur. Infections can come in, and if it tears through that tympanic membrane, it can go further. You might start seeing fluid coming out, which is colorless, and that is coming from your brain. So treat this with the urgency that it needs. Thank you.